my approach to Shockwave, I'm educated as an orthopedic surgeon. I have many doubts with regard to Shockwave treatments for many years. For me, it's like a miracle. It's like you put some acoustic energy to some tissues and you expect some results, some healings and all this stuff. And it's a little bit like a black box, a miracle. And then we started seriously with some scientific works. We looked very carefully to these patients, and we found really that we couldn't confirm these initial findings. And that's the reason why I did a lot of scientific work for extracorporeal shockwave therapy. And why now I think this is one of the excellent options we have as a non-invasive option to treat most of the musculoskeletal disorders with regard to overuse and trauma. Rob asked me to give some basics, some technical information, some biological things, then go for standard indication, new indications, mostly focus on sports medicine. Hopefully I will cover all your interest. I have no idea where you come from. Is it basic knowledge or advanced knowledge, or you're professionals, you deal with shockwaves for many years, or just as a beginner you come here, you hear shockwaves the first time. I will try to pick you up. It's a baseline, hopefully. If any question arise, just give me a hand, show me a sign. We can answer the question and discuss these questions immediately when the slides arise. Better than to hear all the talks and afterwards we discuss it backwards. I have to give this, my trip is sponsored by Storz, partly, yes, for myself, not for the luggage. That's where the place where I come from. I come from Germany, which is right in the center of Europe, pretty close to Denmark, a long distance to Toronto. And this is a picture from the week of Kiel. We are hosting the world's biggest sailing event. We host about more than 9,000 sailors. We have all the boat class, the Olympic class, the non-Olympic class. It's in the mid of June, very comfortable weather, warm and windy. And it's worth a visit to come to Kiel to celebrate this week of Kiel. It's fun, it's pleasure and entertainment as well, and sports. So many years back, we go for 82. This is a picture from the Munich urologist, Christian Chaussy. Christian Chaussy was a very famous, he is still a very famous urology surgeon, and he's performing a lot of surgeries for kidney stones. And then he, together with Dornier, it's a company in south of Germany, he found that shockwave or acoustic waves have the options to destroy kidney stones. It's done by chance. And he did a lot water baths. It's a fixed machine, a very large machine, very expensive. And the procedure takes 3 hours at least to treat the patient with shockwaves, just 3 decades ago. And he went out to the first conferences and saying to the urologist, he has an option to treat patients with kidney stone without surgery. And all the audience were laughing and they say, this is stupid, this is nonsense, this is really nonsense bullshit you're saying. And right now, there's no urologist who has any kidney stones who want surgery in the first line. They all go to the shockwave treater. It will change in the orthopedic field as well. I'm pretty sure the patient with tennis elbow or greater trochanteric pain syndrome or heel spurs or all this stuff, they don't want to have surgery as a first line option, even if they have chronic cases. And he goes to conferences and he was debating for at least 3 years to all his professional surgical colleagues, and they want to push him out of the community, that they don't want to have shockwave because it's cheaper, it's less invasive, and it's less paid than surgery. And the surgeons get much more money from surgery. From 82 until now, most companies have found that it's a big field, it's a growing field, and they have developed many kind of machines. And right now, if you go for the markets, you can approach many companies, you can see many machines. Most of the machines have done feasibility trials and they did FDA approvals and all this stuff. And you can find for each machine and each company physical properties. This is a normal acoustic wave, like a sound wave. This wave propagates very symmetrically. Does not release any energy because the energy level is too slow. If the speed increases, if a very fast pressure wave, then the first parts of each wave can compress the region right here. And if pressure wave compresses a certain area, when the tissue is condensed with higher pressure or higher density, then the speed of the shock wave go faster. That's the reason why a normal wave shows an asymmetric deformation over time, which leads to a very sharp deformation with steepening of the wave in the front side. As an ideal model, this is one of the shock waves is characterized by a very fast increasing time followed by a decreased time, which goes to negative tensile forces and oscillating out. And the velocity and the speed of each shock wave depends from the parameter of the machine and the technology behind. By very characteristically, you can find a very peak pressure which goes up to 100 megapascal, 10 megapascal. This also depends from the technology you have. A shock wave itself, it's a wave you cannot see, but you can see the results as a result of one single pressure wave, which is emitted by just a bomb or something like this. You can see the pressure wave can destroy things like windows. You can feel it if you go for a concert. You see the bass, the reflector systems, and you're staying in front of them. You can feel sometimes that your shirt and your body has a kind of resonance, and it's the reason why shock wave or pressure wave can influence the surrounding tissue. When we talk about shock wave treatment, we have low energetic levels, we have mid energy levels, we have high energetic levels, and this is a publication from Jan de Grompe. He came to Munich and he characterized a repair interval which is up to an energy level of 0.4, about like this. And recently we are working in this range of energy level. We never pass below 0.6 or 0.8 millijoule per square millimeters. Millijoule per square millimeters, this is a description of the energy level. And when we talk about shock waves in the clinical application mode, we are within the range between 0.08 up to 0.32 millijoule per square millimeters. Over the time, we have found different technologies how shockwave can be emitted. This is the first one. This is it's electro-hydraulic machine, and this electro-hydraulic machine has a foil right here, and this has a spark in the middle. And when the spark explodes once, it's emitted a surrounding pressure wave. And the pressure wave is reflected by a mirror and focused in the so-called second focus zone right here. This is primary focus where the spark is discharged, and this is the secondary focus zone. Then we have piezoelectric technique. This is a technique which also has a focused point right here, and at the base of the mirror we have thousands of the piezoelectric crystals, and they discharge also more energy waves, and they're concentrated in a focus zone. 1 year later, comes by Dornier. This is the leading German companies. For many years, they worked with electromagnetic foils. There's a metal foil which is accelerated in speed by a magnetic membrane, and the fluid above the foil is accelerated in speed, and the pressure wave is concentrated by an acoustic lens, which results to a focus zone. Some modifications were done later on. This is, in principle, they are working with focused machines. And this is how it works. Is you see the emission of a pressure wave, and the pressure wave is concentrated by certain acoustic lenses, and it's concentrated in a focal zone. And we use this focal zone to treat certain areas. If you see in this picture, the emission of the shock wave starts right here. It's about 8 to 10 centimeters long when you reach the focus zone. It depends on the machine you have. If you want to treat patients with very deep pathologies, like non-unions after neck fracture, for example, or non-unions for any kind of other fractures, you need a focus device to reach very deep areas. But mostly in orthopedic fields, we have very superficial indications which covered by machines. They produce the focus zone right at the surface of the body. When the pressure wave has passed a tissue, this pressure wave. Behind the pressure wave, you can find these small bubbles. These small bubbles occur when the pressure wave has passed the tissue and a negative tensile forces is left. And tissue is very sensitive for tensile forces. It's the reason why these vacuum-filled negative vacuum bubbles occur. They collapse within a very short time frame. If then you have an electrohydraulic system, the problem with the system is, for sure, it produces very high energetic shock waves, but each shock wave has reached an inconsistent energy level, so it's not very precise. The energy level is high, but the preciseness is not that good. When we have focus devices, we talk about a focus zone, and within the focus zone, we reach a certain energy level. That means 50% of the maximum of the energy is found within this range. And depends from the machine, the focus zone is like a cigar-shaped one, or it's an oval shaped one focus. So you can make measurements on each focus zone. We can measure the so-called minus 60 dB focus zone. We have a 5 megapascal focus zone. These are all physical parameters. We are still unsure in the societies it's useful to have these parameters or not. But until now we talk just about the energy flux density, which describes the energy passing a certain area. This is an example how focus machine works. In the latest development in technology is to adapt all these superficial indications. It's called the radial technology. There's a pressure wave that has a focus right at the tip of the applicator. This is the applicator of a radial device, and the radial device emits shock waves right at the tip of the applicator. It comes out in Germany in 1999, originally in Switzerland, by a company which is close to Constance, Lake Constance, and they come out to the market and were able to fit all these superficial indications like tennis elbow, lateral epicondylitis, great trochanteric pain syndrome, and plantar heel pain, for example. This is how it works. It's based on so-called elastic collusion, where a projectile is accelerated in speed and hit the tip of the applicator, and then the pressure wave emitted to the tissue. The speed of these waves, or these bullets, are between 10 or 20 meters per second. So it depends on the technology and the source of power you have. This shows how a handpiece works. This is a schematic handpiece. This is the tip of the applicator, and you put the tip of the applicator right at the skin of the patient, and the projectile inside. The projectile is accelerated in speed to hit the applicator, and then the pressure wave is emitted. Compressed air accelerates the projectile, hits the applicator, and finally, so the shock wave is emitted radially. In the International Society, we have a long debate about which is a focus device, which is a radio technology, and right now there's a consensus that this is so-called radial shockwave device, and the other device called focus shockwave devices. These devices are characterized by a focus zone which is right at the tip of the applicator, and from this point on you have a radial distribution of these pressure waves. Many advantages which I can explain later on. This picture shows the difference in the discussion. This is, for example, it's an electromagnetic system which has a spark right here, which emitted the pressure wave, reflected by an acoustic mirror, concentrated in the focus zone. This focus zone is used to treat patients. For example, you have a focus zone. This is the distance from this zone to this zone is about 8 to 9 centimeters. It's pretty hard to place this focus right superficial. And you have trigger points, you have tennis elbow, it's pretty hard. That's the reason why the companies are looking for options to put something in between, because this distance is fixed by the machine. You cannot change it anymore. You can change the energy, but you cannot change the morphology or the physics. The radio technique, it's pretty easy to place the focus zone, the tip of the applicator, right at the region of interest. This is one of the machines. You have these machines also here. I think you have for hands-on later on. You can check all the machines and you can see how to work with these machines, and you can get an impression how much energy is released by these energies. This is a very detailed picture we get from the laboratories with hydrophones. These are so-called microphones we can use underwater to make measurements of each of these pressure waves and characterize these shock waves. This is one single shock wave, which you have seen before in the schematic view. This is the increased time, this is decreased time, this is the negative tensor forces, and that's the end of the shock wave. This is an electromagnetic device from Dornier. It's called a focus device. And the discussion from the, it's a very competitive market, and the companies fight each other to find some characteristics better than the other company, but this is still nonsense from the clinical point of view. And this measurement is done by our laboratories from the radio technology device. From the first view, you can see it looks pretty similar. The time we have right here, the length of each shock wave is longer in the mechanical radio technology device, but the relatives, the formation of the shock wave itself looks pretty similar. These shock waves are right now available in the market. We have the radio techniques, we have the planar techniques, radial and defocus devices as well. Right now we use techniques with defocus devices. We want to treat patients after the focus zone if they have some neurology pathologies like spastic deformities or spasticity after stroke. If you have these techniques, you have to be aware that you can place a focus zone right in the region of interest. There are many options published. There are very expensive options. There is a CT guided technique performed by some Austrian colleagues, which is very invasive with regard to X-rays. But mostly right now, 95% use so-called biofeedback technique. So this biofeedback technique where the patient itself guides you to the region of interest. The patient is immediately able to recognize memory pain. If you use the tip of the applicator, you squeeze around the lateral tennis elbow or the lateral epicondylitis, the patient can immediately say that it's a painful treatment for sure, but when the tip reaches the region of interest and hits the painful area, they have immediately memory pain and they pretty hard to tolerate the pain level. So this is right where the patient guides you to the right spot. We call it as a biofeedback technique. If you have a focus device for bone pathology or for calcific lesion on the shoulder where you need a very, very described fine area, you need a control system to be sure that the focus zone is right in place. That's the reason why this mostly ultrasound guided application is recommended if you treat the bone pathology or use focus devices. What's happened with shock waves is shock wave passes a certain tissue. This is a measurement what we did in Munich to analyze what happened with the energy level of shock wave, and shock waves were emitted to a certain energy level to a certain tissue. This is a normal standard gel. This is a muscle layer with 1 centimeter, 2 centimeters, 4 centimeters. This is cobalt chrome, which we use for metal, for osteosynthesis. This is a cancellous bone with a certain thickness of 1 centimeter, 2 centimeters. This is a ligament patella with 3 millimeters in thickness. And it's pretty easy to see how much energy is lost when the shock wave passes certain tissue. So all the physical parameters you can see on the websites from all the companies, they are performing measurements in water baths. It's without a model. And if you put some certain tissue in between the tip of the applicator and the focus zone, and you use hydrophones to make measurements of the energy level, you can see that, for example, if a 4 centimeter thick muscle layer, the energy goes from 0.16 down to 0. It's pretty hard to make a measurement for any kind of energy which reaches the region of interest. Just to keep in mind what's happened with shockwave if they pass a certain tissue. Initially, this is the model how shockwave can work. This is a working model firstly described by Markus Löw. He's an orthopedist in Europe, a very famous shoulder surgeon, and he's dealing with shockwave and calcific lesion of shoulder. And he stated that it must be mechanical effect, that shockwave are destroying something. So might be producing microfractures, micro lesions, and these micro lesions if you can see this in the model stone, leads to a resorption of these kinds of lesion, which induces a certain local repair system. So direct effects can only occur if you have acoustic differences with regard to densities. So it's called acoustic impedance. As big as the difference is, as big as the step is of these acoustic impedances, as much acoustic energy is released and changed to mechanical energy. That means you have a lot of destroyment and micro lesions in a high energetic level if you have a strong step of acoustic impedance, for example, between bone and fat layer, or skin and air. There the acoustic properties are very different. We have the working mechanism of cavitation. You have seen the bubbles before. When the shockwave had passed the layer, all the tissue is compressed. The shockwave when it had passed the region of the region, then you have negative tensile forces, and you have a disruption of local tissue, which leads to so-called vacuum-filled cavitation bubbles. This is the most important thing, how shockwaves works right now on the biological pathway. This is for sure, we have these cavitation bubbles in all these machines. And when a cavitation bubble occurs, this cavitation bubble is filled with vacuum because of negative tensile forces around the bubble. When the negative tensile forces were gone and you have zero pressure level or differences in the tissue, then the bubbles collapse. And when they collapse starting from one point, collapsing asymetrically. By collapsing, they're producing so-called local jet streams. So they accelerate fluid around the bubble, this accelerates in speed, and it's a tip where the colliding bubble has the most intensive pressure point. You have micro lesions by these microjets. The microjets have a velocity of 900 meters per second. And we talked about the acoustic properties and impedances. This is a table showing how the acoustic impedance is. Impedance means density. And you see the parameters right on the right line right here. You see the big difference between air, for example, and kidney stones or cancerous bone. As big as the step is, as much energy is released or transformed from acoustic energy to mechanical energy. This is how these cavitation bubble works. When they collide, they produce these so-called the microjets. The microjets producing these local lesions at model stones. If you look pretty close, you can see these very small holes. These holes occur by these microjets induced by cavitation bubbles. This is a film showing that the community is saying that the radio technique has not enough energy level. This is a typical applicator. This is a model shark stone, and you see the 1 centimeter distance between the tip and the stone. You see for sure there's a lot of energy is released and transferred from acoustic to mechanical. And the society was surprised when we first released this film. Because the statement of the focus machines and companies say that the radio technique has not enough energy. When I see this model stone, it's pretty easy to imagine that the energy for sure is much enough to treat all these pathologies. The other issue is that radio techniques that don't have any cavitation bubbles. If you look for this film, you see these small points, these small dots right here. These small dots, they are all cavitation bubbles. You have the same pressure wave, which is emitted radially, and behind this radially emitted shock wave, we have these cavitation bubbles for sure, also in the radio technique. You see the radio emission, you see this is a hypersonic speed camera with certain technique to visualize all these pressure steps. And the black dots, these are all the cavitation bubbles occurrence. This is schematic. You see, this is a hydrophone. This is a microphone we use to make the measurements, and all these small bubbles right here. These are cavitation bubbles, and when they collide, they are producing local radial shock wave. All these small cycles right here. These are local radially emitted shock waves by colliding cavitation bubble. Is this relevant to have the cavitation bubbles? This is in study setup and a clinical study setup where they put a sciatic nerve in an experimental design, and Schelling published it many years ago with in degassed water baths. Degassed water baths means it's the risk to have cavitation bubbles is pretty low, and you have a normal water with gas inside, the risk to have cavitation bubbles is much more higher, or the probability to have cavitation bubbles is much more higher. And if they have a degassed water, no cavitation bubbles occurs. And when they have degassed water, the sciatic nerve has not shown any kind of activities. When cavitation bubbles occurs, then the sciatic nerve has found to produce an electric impulse. It's published in a very good journal from Schelling. He came from the Ludwig Maximilian University, which is in Munich as well. Finally, after these technical aspects, just this very short look inside behind all these technologies is which technique should be used for the clinical application. This is far away, and a complete other question should be answered later on. As a very short slide, which shows right here that after radio technique comes out to the market, many users switched over from the focus devices to the radio device because the application is much more easier, and you reach all these local pathologies pretty easy, and most of the orthopedic pathologies are very surface related and within a distance of 2 or 3 centimeters at maximum, and so we can mostly cover all these pathologies with the radio technology, except pathologies like delayed unions or non-unions or calcific lesions and all this stuff. Trigger points, soft tissue pathologies can be covered with the radio technique for sure. This is a short review for the technical aspects, and Rob, I have no idea how many machines they use and which kind of knowledge they have, and I can invite you for sure if you really have deep interest. There's once a year an international conference. The next year will be in Argentina. It's worth a visit to come and to hear all the talks about these techniques. This is for techniques.
Thank you. I'm just going to make a couple comments, and we'll have questions in a second. Also, these are great meetings. They're very friendly. They're congenial, and they're not speakers that get up there and get attacked. Everyone works very well together, and it's a wonderful meeting to go to if you have a chance, and learn a lot of science as well. So I'd like to thank Ludger for the science. A lot of people don't get to see this kind of presentation on how shockwaves work. So I thank you for that wonderful presentation. A couple of things I'd like to comment on. One thing that comes up a lot in Canada is energy level. And there's other companies out there that say you need a lot of energy, you need a lot of energy. Well, Dr. Gertesmeyer showed you that the efficacy of the energy level is all within the parameters of these machines and in the radial shock waves. So that was a very important point that Dr. Gertesmeyer made. And the other really important one was the biofeedback. And Dr. Gertesmeyer is actually one of the original people to actually talk about that and write about it and publish it, that you don't need an ultrasound machine or a CT scan to find out the area that you want to treat, right? So you're using biofeedback, and some of you that have been with me and have been to training know that the biofeedback is critical, especially with the radial shock wave. And one thing that I did not mention that I'd be remiss to say is we're just introducing a new generation of shockwave devices, which you will see here today.